Hi, everybody. This is Lisa Adetta in El Paso, Texas. I hope everybody is doing well. I will be presenting a case study of a patient that I recently took care of at the primary care clinic that I am precepting at. I will present the reason the patient presented to the clinic, the patient history, my assessment, and the plan of care. MT is a 3-year-old male accompanied by his parents who presents to the clinic with complaints that MT has been having choking spells every day as he sleeps and naps. His mother is the primary historian and is deemed reliable. Regarding the chief complaint, according to mom, for the past month we have noticed that every time MT goes to sleep or when he naps, he has loud snoring episodes that almost sound as if he is choking. The history of this presenting illness, mother states that MT has not had any recent illnesses or fever. She states that these episodes have been occurring every day for the past month. She states that these episodes occur during the day while he is napping and then when he is asleep. She goes on to describe that they last only a few seconds, but that they can occur many times during the night. The parents state that MT wakes up briefly during these choking spells, but then he returns back to sleep. They state that his color always remains the same, and they do not witness any other accompanying symptoms. Father then attempts to demonstrate what these choking episodes sound like, which is a lot of gurgling sounds. Regarding the review of systems, the overall general assessment, growth is normal, his speech is appropriate, there are no concerns regarding his hearing. Nutrition includes a regular diet, however, mother does state that MT is a picky eater. Despite these episodes at night, mom states that MT still has a good sleep pattern in which he averages about 11 hours of sleep a day, including his naps. Regarding his skin, she reports that there are no skin abnormalities. She denies any rashes from him. Regarding his head, mom states that there is no history of head trauma. Regarding his eyes, mom states that there is no history of redness or drainage, no eye abnormalities. Regarding his ears, mother denies MT having any recurrent ear pain, any ear drainage, any recurrent ear infections. Regarding his nose, mother does state that he occasionally complains of a stuffy nose, but that he does not have any recent history of drainage or cold symptoms, and he does not have a history of seasonal allergies. Regarding his throat, mother states that he does not have any history of recurrent throat pain, any recurrent throat infections. There are no complications when swallowing. However, mother does offer that she notices him mouth breathe a lot. Regarding the endocrine system, mom states that he does not have any complaints of excessive thirst. There is no intolerance to heat or cold. Regarding the cardiovascular system, MT does not have any murmurs, any palpitations. There are no history of cardiac complications. Regarding the respiratory system, mom states that he does not have any recurrent cough, no difficulty breathing. Regarding the gastrointestinal system, mom states that he does not have any history of abdominal pain, no history of recurrent vomiting or diarrhea, bowel movements or within normal limits. Regarding the genitourinary system, mom states that MT does not have any abnormalities upon urination. He does not have any pain. Regarding the musculoskeletal system, MT moves all extremities equally and without complication. Regarding MT's neurological system, mom states he does not have any history of neurological abnormalities. There is no history of seizures, no abnormal twitching. Regarding his hematologic system, mother states that he does not have a history of any bleeding or any bruising. MT does not have any known drug allergies, and he does not require any daily medications. Regarding his past medical history, he does not have any history of past surgeries or hospitalizations. Family history includes mother and father both denying any major medical complications. MT has an 8-month-old sibling that does have a history of seasonal allergies. Regarding social history, MT lives with his mother, his father, and his sister in a single-level home. MT is cared for by his mother during the day. However, the family is anticipating enrolling him in a daycare starting this fall. Regarding my objective data and my physical exam, my overall general assessment, MT appears age appropriate. He is active and playful in the exam room. MT is in no apparent distress. He is talkative and answers questions appropriately. Vital signs are as follows. Temperature is 98.9, heart rate is 104, respiratory rate is 24, and blood pressure is 90/70. Regarding his skin, skin is intact, there is no rashes noted, normal skin turgor without lesions. Regarding his head is normal cephalic and atraumatic, hair growth is normal and well distributed throughout his head. Regarding my assessment of his eyes, conjunctiva is non-injected, sclera is normal in color, white, no jaundice. His lids are without ptosis, without edema, there's no erythema noted. Extraocular movements are intact, pupils are equal, round, and reactive to light. There is a red reflex noted bilaterally, and there's no eye drainage noted. Regarding MT's ear, nose, and throat exam, bilaterally, his tympanic membranes are shiny and gray with sharp landmarks. There's no discharge noted. However, I do notice some mild nasal swelling, but he does not have any visible nasal drainage. Bilaterally, his middle turbinates are slightly swollen and can be categorized as a grade 2. I visualize some all dry blood. This is noted on the lining of the right nair. When asked if MT has a history of nosebleeds, mother then says that he has been having some nosebleeds for about a month. They occur sporadically during the week. She says maybe 2 or 3 times a week. His oral mucosa is moist. He has adequate dental hygiene. Oropharynx is without redness or exudate. Tonsils are slightly enlarged and rated a grade 2 in size. Regarding his lymph nodes, there is no tenderness noted upon palpation. Regarding his thyroid, no thyromegaly is noted. Regarding MT's heart exam, he has a regular heart rate and rhythm. Normal S1 and S2 sounds are noted. There's no murmurs, no gallops, no rubs noted. Regarding my assessment of MT's lungs, unlabored respirations, he has clear breath sounds bilaterally. There's no wheezes, no crackles. Symmetric chest expansion is noted. Regarding assessment of his abdomen, it is soft without any organomegaly. Bowel sounds are normal, non-tender. There's no palpable masses and no abdominal distension. Regarding my assessment of MT's genitalia, normal external male genitalia is noted. Regarding his spine, spine is straight with no lesions. Extremities, peripheral pulses are equal. There is no clubbing, no cyanosis, no edema of the extremities. Capillary refill is less than 2 seconds. Regarding mental status, MT is alert and appropriate for age. A neurological exam, normal reflexes, normal tone. There's no focal deficits. He is responsive and appropriate. So my assessment, my differential diagnoses that I come up with after my assessment, number 1, nasal congestion. Number 2, epistaxis. And number 3, hypertrophy of the tonsils. Now, my pertinent positives and negatives that support my chosen diagnoses from the history are as follows. Number 1, mother states that she notices some abnormal breathing patterns during MT's sleep. They describe this as choking episodes. Number 2, these episodes have been occurring for the past month daily, both during his naps and when he sleeps at night. Number 3, mother notices that MT does mouth breathe a lot. And number 4, no other symptoms are accompanying these episodes. There's no recent history of illness, no fever, there's no change in color, no seizures, no twitching during these episodes, which nothing that would indicate that these episodes are associated with any type of cardiovascular or neurological component. Pertinent positives and negatives from my assessment. Number one, that I visualized mild nasal swelling bilaterally. His bilateral middle turbinates, again, are categorized as a grade 2. This means that the turbinates occupy approximately 26 to 50% of the total airspace. Number 2, upon my assessment, that we found old dry blood and residue that was noted on the nasal lining of the right nair. And then number 3, MT does have bilateral tonsillar enlargement, categorized also as a grade 2, meaning that the tonsils occupy less than 50% of space between the pillars of the oropharynx. So basically with all of this, came to the conclusion his increased nasal congestion and his enlarged tonsils are what is causing him to snore and have abnormal breathing patterns during the night. So our plan is as follows. Number 1, we are recommending to mom that he use AYR nasal saline gel. This is going to help to moisturize the linings of the mucosa of the nose. All he needs is about half of the fingertip of, that's the amount, and you topically put that inside the bilateral nairs 3 times a day for 3 days. And this was, again, to moisturize the inner mucosa. Number 2, we are recommending that she use a humidifier at night. This is to improve the air quality at night so that it's not so dry, to help him breathe a little bit easier. Number 3, we are going to discuss a proper procedure that parents are to follow in case he has any future nosebleeds. Number 4, we are going to discuss making an emergency nosebleed kit that they can have to use and they can carry with them at any time. And then number 5, we are going to take a tympanogram reading of both ears. And when we do this, we do notice that both ear pressures are within normal limits on both sides. We decided to do a tympanogram reading on both ears because of our assessment finding of the enlarged nasal turbinates and the hypertrophy of his tonsils. We will continue to monitor the enlarged tonsils to see if there's any change in size, to monitor for any recurrent throat infections. In the event that MT needs to be referred to an ENT at a later date, we will already have a tympanogram reading documented. So regarding education for mom and dad, we actually educated and demonstrated how to properly handle a nosebleed. We instructed them that when he does show signs of having a nosebleed, they need to lean the child forward. They need to actually pinch the soft part of the nose forcefully and apply pressure for about 5 to 10 minutes. Encourage the patient, remind them that they have to breathe through their mouth and that bleeding should not persist for longer than half an hour, 45 minutes. In the event that it is 30 minutes or more, they need to seek medical attention immediately. So we let mom and dad both demonstrate on each other where and how, and most importantly, that they need to have the child go forward, breathe through the mouth, forcefully hold down for about 5 to 10 minutes, and in the event that it continues past 30 minutes, seek medical attention. Next, regarding education, we also explained to them how to assemble an emergency nosebleed kit. We told them that they can get any of these supplies, Walgreens, Target, Walmart, just get the gauze, any type of gauze, the small little squares, the 2x2s, some Afrin spray. Afrin spray temporarily shrinks blood vessels, so that needs to be, they're going to squirt that in there to kind of help reduce and shrink the blood vessels. And then any cleansing wipes to help with the mess during. So they can easily carry with that in their purse. They can send that in a backpack as he's getting ready to go to daycare and school, just something to have in an emergency. Follow-up for MT, we are advising that mom return to the clinic with him in 6 weeks or sooner if symptoms persist or worsen. We are hoping that with these recommendations, we will notice they are going to report to us a decreased amount of snoring, improved sleep, hopefully we will see a decreased size of the tonsils, and we will decide at that time if there's any further actions that are required. Regarding my debriefing, overall, I wasn't quite sure what the outcome was going to be with this particular case study. We had heard that the initial complaint was choking episodes. So I first was thinking possibly reflux, some type of respiratory illness with increased mucus production or cough. After the assessment, after the patient history, after we ruled all of that out, I felt I really had to be careful and look at my assessment for clues. On points that I could have improved on with this particular case, I think I focused too much on the obvious during my assessment. I saw no visible nasal drainage and saw only slight mucosal swelling. After I did my assessment, my preceptor came in and followed me, and she also examined the patient. She's also the one who pointed out the old blood residue and asked mother if she'd seen any history of if MT has had any history of nosebleeds. This was information that the mother did not offer initially during the patient history in the review of systems. In the future, I do see the importance of really manipulating the NURS, using the light source to get in there and to fully visualize both the NURS and to look at the turbinates and see if there's any type of obstruction or grading that we can do on the NURS. Number two, another point, I was finally able to practice using the tympanogram during this case, but I had some trouble finding the correct angle and positioning. I had to try multiple times. I just couldn't get the right angle positioning the tympanogram into the ear canal. Once I was able to get a reading, I still had to go back and determine what it was that I was actually looking at on the instrument. Going forward, I still need to practice utilizing and implementing this instrument during my future assessments. But in the end, I think the treatment plan that we developed was very straightforward and practical for the patient and the family. The parents seemed pleased and relieved after explaining the cause of their child's episodes. This concludes my presentation. I hope this information can be of some use to you in the future. Thank you and goodbye.